Well, welcome to Rochester Lifestyle Medicine Institute's Lifestyle as Medicine for the Planet presentation for the month of July 2024. I am Dr. Ted Barnett, the high-tech doctor with low-tech solutions. Some people know me as Dr. Veggie. I'm also president and founder of Rochester Lifestyle Medicine Institute, and it is so great to have you all here tonight. Very excited about our presentation tonight. We have Dr. Scott MacRae, local physician in Rochester, New York, and we'll be speaking on why and how to make our world more bike and walk friendly. These are some of our upcoming programs. Rochester Lifestyle Medicine Institute presents two programs which are certified by the American College of Lifestyle Medicine, including our very own 15-day whole food plant-based jumpstart, and also the LIFT project, which was developed by Darren Morton in Australia. We recently introduced health coaching. If you'd like to have individual attention from one of our coaches, we also have group coaching available as well. And we've also recently launched our new community platform called paleblue.community. And that's where this lecture is being hosted. And we also will be posting the post-event recordings, chat logs, discussion spaces, transcripts, etc. And it's a simple, easy to use interface. We also run our programs on there now, so our courses and our other programs. And we do have an app called the paleblue.community. And there's a free trial, a 30-day trial, and then after that, it's the low price of $5 per month. Now, let me tell you about Dr. Scott MacRae. He gained a greater interest in bicycling while in medical school at the bike-friendly University of Wisconsin. He subsequently moved to Portland, Oregon, where he served for 17 years as a LASIK and corneal transplant surgeon and director of the Oregon Eye Bank. He watched downtown Portland transform from a downtrodden area to one of the most robust cities in the U.S. just prior to his departure from Portland after being recruited by the University of Rochester 23 years ago. He noted the city was starting to lay down striping for bicycle lanes. He bicycled on rural roads, but dismissed the idea that these bike lanes would ever be a safe option for the rare urban cyclists in Portland. But during a visit to Portland in 2009, Dr. MacRae saw that the bike lanes were full of cyclists commuting to and from downtown, an area that was now thriving with cyclists, pedestrians, and small businesses. Back in Rochester, he began educating himself on the economic, health, safety, and quality of life issues surrounding cycling and active transportation. He became involved in and was president of the Rochester Cycling Alliance, a bicycle and walking advocacy group, and helped it to merge with Reconnect Rochester Transit and Safe Streets Group. Dr. MacRae has lectured and discussed biking and active transportation issues with public officials and cycling advocates in numerous cities. So without further ado, I'd like Dr. MacRae to reveal himself. Turn your camera on, and we're going to hear his presentation on why and how to make our world more bike and walk friendly. So welcome, Dr. MacRae.
Thank you. So
Absolutely.
let me pull up my talk. Thank you, Ted and Susan, for this kind invitation. Let's get started. Can you see my my slides all right?
Yep, it looks good. And I'm going to disappear now.
Okay. See you, Ted.
All right.
So I wore my Rochester bike t-shirt, my favorite bicycle t-shirt, just to honor the occasion. So thanks again for the kind introduction. And tonight I'm going to talk to you about biking and walking and the issue of active transportation, but I'm going to concentrate mostly on biking and walking. There are other forms of active transportation, especially transit, but active transportation really includes any non-motorized version of getting around, a non-car-centric approach to moving people. So the objectives tonight are basically to inform you of the safety, health, and economic benefits of active transportation and climate change, in addition to motivate you to encourage healthy movement by foot, bike, and transit, to inspire you to promote a more accessible, safe bike and walking system for more health and happiness, and to understand this issue of how health and safety are deeply connected. And this is something that I've kind of learned over the years, and to identify tools to promote both, how they interact, how we design our environment in a safe way so that people want to get out want to get out and bike and walk and get out into our community. So to address this, one of the first things we need to do is look at what is the built environment. And this includes roads and transportation and how things move around with that transportation system, the buildings that we have and how housing is apportioned and the density of housing. In addition, how we access parks and public spaces, and zoning and funding actually become quite critical. This is a little bit more of a technical area, but that's what we try to hold our legislators accountable for in terms of making our built environment more people-friendly. So built environment directs how we move and work and play, and it also determines our carbon footprint. So it can directly impact climate change. So this is taken from one of the CDC lectures that I attended years ago, who was kind enough to lend me a few slides. And I love this slide because it basically shows how suburban developments totally neglect often pedestrians and cyclists. You'll also notice that there are fences all the way around in the backyards of these neighborhoods. So for kids, if they want to get from one street to another, they'd have to use the road. But the road is, you'll notice, is very wide. And that wideness actually encourages cars to go fast. We call that a collector road, where the road is actually just designed for cars. It's car-centric. It's not really designed for pedestrians or bicyclists. There's no sidewalks. It's basically a system that pumps individuals into the artery of the car-centric transportation system. And this is sort of an exaggeration of it. In Denver, Colorado, Ted Turner, when he saw this, he said that he thought that Denver would probably just extend all the way to the Pacific coast if there wasn't the Rocky Mountains. But you can see how these designs basically encourage cars to sort of feed into a large expressway, and cars are going very fast to get to that point. And on the way, we see large arterial type systems like this. And for a pedestrian or a bicyclist, navigating this becomes very, very difficult. This is a pedestrian who unfortunately is trying to get across a 7-lane road. And this becomes sort of a treacherous journey for that individual. You'll also notice on the slide on the far left, where the sidewalk is, it actually disappears. So the walking facilities is very sketchy and chopped up. So it's not very pedestrian friendly as well as bike friendly. The one thing that, if you notice carefully in the red car, there's one good thing, and that is that some people are having ice cream, although hopefully it's vegan ice cream, but they're enjoying that, while the person at the far end, who's the pedestrian, is actually under, I'm sure, a great deal of stress and potentially at risk for an injury. So let's first talk about carbon emissions per capita. And the United States basically leads the developed countries in terms of carbon emissions per capita. It's not something that we necessarily want to be the best in the world or the highest in the world. Other countries like the Netherlands, Denmark, and Sweden are dramatically less. In Sweden, which actually serves as an interesting example to us, has about 1/4 the carbon emission. And we're going to swing back to Sweden when we start talking about Vision Zero, which is a system to minimize motor vehicle, bike, and pedestrian injuries with a system called Vision Zero that was actually developed in Sweden. But their design actually really helps minimize carbon emission. So we can learn from other countries how that happens. One of the things that I've learned over the years and always thought of is that humans are made to move. In prehistoric times, we were basically incentivized to move around, to find food, to forage for food, to find shelter. And when we did, then we would rest. But then came modern civilization over the past 100 years, and we've become increasingly more sedentary. And the only ways that we get movement oftentimes is by going out and trying to get exercise. But there are other ways that people are moving around the world. Some people are using their movement to transport goods. We're also using movement to enjoy recreation with our families or get away on our own, or sometimes explore places that we don't see normally. We also use it for exercise, whether it be walking or biking. So we can move, and the more we move, I think the happier people are, as I'll show you in just a few minutes. But we're also basically lazy, and there are actually evolutionary advantages to doing that, especially in earlier times. We gravitate toward rest, and that's actually a good biologic thing, that once you've had enough food and you have the opportunity to rest, especially in prehistoric times, it was an advantageous thing from an evolutionary standpoint, because then you were ready to go out and forage for food and shelter again at another time. So we naturally would conserve it. But now, over the last 100 years, it's been easier and easier just to rest without actually moving. And unfortunately, now we see sort of a crisis with younger people who are sort of fixated on their cell phones or digital devices. And there's less and less movement, which has precipitated the obesity crisis and lots of lifestyle health problems. So we're going to talk tonight about the pedaling and walking revolution, which is an international trend. And some of the issues we'll talk about are healthy lifestyle, happiness factor in terms of biking and walking. Basically, it's fun. And when I talk about this, I often get into the numbers and statistics, but the bottom line is that people really enjoy getting out, biking, walking. And for Ted Barnett, who's a big hiker, he knows that that's a great thing as well. It's terrific for stress reduction in mental health, and we'll go into some of the studies that have been done on that. It's also an important issue in terms of equity, and we're going to talk some of that. And we're going to spend some time on safety and environmental design and how that's affected. We'll also talk about the huge economic benefits of having a good biking and walking and active transportation system. One of the things that I enjoyed as a child was I was a free range kid. I spent pretty much all my time. I could get out, hop on a bike or walk to wherever I wanted to go without worrying about how I'm going to get there. More and more, because of the last 50 years, the way our roads are designed, it's become more of a parental worry when in terms of whether they're going to let their kids out and be free range. But we want to try to create environments that allow children to be more free range. I think it's great for them to have that sense of autonomy. We'll touch a bit on e-bikes and what a powerful new technology it is for getting around, the social connection that happens with biking and walking, and the environmental impact. So let's start off by talking about cycling and walking and some of the mental health benefits. There are numerous studies basically showing biking and walking are better for your mental health. Switching from an auto to biking or walking improve mental health and well-being. And there are other studies that basically show the more time commuting in a car, the more depression, and also the more congestion one experiences, the depression rates also go up. And there are a number of studies basically confirming this. This is just take one of those, basically looking at commuting well-being or basically happiness. And the bikers and walkers basically are the ones that have the highest level of happiness. And you'll see in just a few minutes health benefits as well. As one moves to the right, if you're driving solo in a car on your commute, that's the least satisfying in terms of getting around on your daily commute. So study after study shows that cyclists actually are the happiest commuters. And why is that? Well, there's less cortisone and blood pressure spikes in cyclists and walkers. In addition, there's a dopamine release that occurs with exercise, and we're going to actually go into a little bit more of that in just a second. There's also greater alertness, and there are actually studies basically showing the kids perform better if they bike or walk to school. Before they get to school, they actually do better on tests, and they're more activated, more ready to go and participate in school. And also, there are sleep benefits in terms of whether you're a consistent biker or walker during your day. So this is a study that I really liked. I dug around a lot in the literature for this talk. And this was a study done in New Zealand and Auckland. And they took a group of motorists that switched to e-bikes and then looked at, surveyed them after a period of time and basically looked at why they liked e-biking. What was it that really stood out for them? And there were 4 things that basically stood out. The other thing is that the e-bikes were actually, one of the things is that they're really handy. People often kind of poo-poo e-bikes and saying, well, that's not real exercise, but it actually turns out that people get more exercise e-biking because they actually use an e-bike, and they can go further, and they can actually go on terrain that they normally wouldn't go on, and also actually keep up with people. Let's say if there's a couple that's e-biking. But one of the advantages was basically a high degree of commuting control and arrival time reliability. Now, this was probably an area that really had good infrastructure, so people could reliably get from point A to point B without getting into congestion. But the most interesting thing that I found was their second point, and that was that there were enjoyable levels of sensory stimulation. They called this phenomena multisensory activation. I'd never really thought about this. I've been biking for 50 years, and I love biking, but I never really understood it in this context. That is, there's a sensory component to your joy of biking or walking, but there's also a motor component, but they actually isolated the sensory part. That is that you're looking around, you're surveying. When you're biking, you're looking at the pavement. You may be looking at a car or some people on the street, or what's going by you in the street environment, or if there's trees. You also hear the sound of the birds or whatever sounds you hear. There's interaction with other people. So there's this real intense sensory stimulation. And you don't get that when you hop in your car. You go from one box, you get from one box, you get into another box, and then you get to another box. You're sort of coned into a low sensory stimulation. So there's that multisensory activation. I love that term. So there's also the motor component. So we've got the sensory component and the motor component, the feel better effect of moderate intensity exercise that these e-bikers had. And the other thing that they really appreciated was the greater opportunity for social interaction. And I also understand this because when I bike commute to work, I always see these 2 women that are walking their dogs. I always wave and say good morning. And then I'll see 3 or 4 other people that I know, and I have that interaction with them. But not only do I have that interaction with them, I also have an interaction with the houses, the streets around me. I get to know the neighborhood. Whereas when I'm in a car, I'm going so fast, 30, 40, 50 miles an hour, I fly past neighborhoods, I fly past shopping areas, and I don't really perceive what's going on there. So there's that interaction, the social interaction with not only people, but with also the environment, and you explore more. Actually, there are studies also showing that people shop more, they spend more money on a bike than if they fly by in a car in a retail area. So active transportation, biking and walking actually promote physical health. We all know the problems with the adult obesity and childhood obesity problems. I'm not going to belabor that. And we also, I personally think that if we can get kids to bike and walk to school, it would really promote a lot of health in their youth and those developmental teen years. They're building good habits. They're less likely to fall into a overweight or obesity problem if they do that. It's certainly not the only solution to the obesity problem. Certainly diet is critical, and I don't want to undermine that, but that combination can be really, really powerful and as a tool to obviate some of the health problems that we have. So in the costs that we also know that my audience probably is very familiar with all the costs of inactivity and the lifestyle problems that we have as a result of a relatively inactive, unhealthy lifestyle. So in Holland, 1/3 of all trips are done by bike, and the adult obesity rate is 3 times lower than the United States. The childhood obesity rate is 3 times lower than the US. And in Holland, children bike and walk to school. And I think that this has a profound impact actually on their obesity rate. So if you Google Holland school bus, you know what you get. You get Holland, Michigan, you get Holland, New York, but you don't get Holland, Holland because there are no school buses. So I was searching around on the web to find out about Holland school buses, and this is what I found. So let's see if we can run this video. This is a Holland school bus. There they go. So I love that video, and the people are just going. If you've ever cycled in Holland, it's a little bit like a video game for somebody that's not used to that, but those people are very used to it, and so they just move along very, very aggressively. Well, there are plenty of health benefits of cycling, and frequent bike commuters basically live 2 years longer than non-cyclists. They have 15% better work attendance. The top 8 biking and walking cities have a 20% reduction in obesity and diabetes mellitus. So there are plenty of health advantages to cycling. This was a recent study that I just ran across, a Scottish longitudinal study in which they took 82,000 subjects, and they looked at outcomes over 18 years and compared cyclists to other non-cycling groups, as well as walkers. And they found in the cycling group a pretty dramatic reduction in all-case mortality, 47% reduction in all-case mortality, 51% reduction in cancer mortality, 20% reduction in mental health treatments requirements. They also had a reduction in cardiovascular disease and mortality. And I didn't mention that or didn't show it, but the cyclist also had a 2-fold increase in traffic hospitalization. So there is kind of a double-edged sword to this, but when I looked at the study carefully, there were only 80 incidences where the cyclists were hospitalized out of the 82,000 subjects. So the numbers, even though it's a little bit higher than the average Scottish individual, it's a very, very small number, and it's relatively rare. The pedestrians had gains also, but they were milder. They're around 10% for those things that some of the similar indices. But what they concluded after they looked at the safety risk versus the health benefits, that there were massive health gains for cyclists, which far outweigh the safety risk. And that's a theme that I've seen over and over and over in the public health literature. And yet, when I'm on a radio show or whatever, inevitably people are always worried about that safety issue. But I'll go into that in more detail right now. So one of the issues is basically health benefits versus safety risks, and it's a critical issue, especially in a place where infrastructure is not that good. But there's a difference between perceived risk and actual risk. So in terms of the health benefits, and this is taken from quite a bit of public health literature, the health benefits comparing to the safety risks, the health benefits outweigh the safety risks in, let's say, in a place like London and San Francisco, which are very, very intense motor vehicle cities. The health benefits still outweigh the safety risk 5-1. In a place like Barcelona, where the cycling infrastructure is terrific, I've been to Barcelona and it's great. The health benefits outweigh the safety risk more than 20-1. It's actually quite a bit higher, but I'll just keep it at 20-1. Rochester's probably somewhere in between. It's probably 10-1. So I coined this term, you're safer on your bike seat than you are on the couch, because there's so many health benefits to getting out and riding and walking, basically. So let's not be a couch potato. So one of the things that's become very important in terms of the bike advocacy movement is bike and walking equity. And Blacks are actually the quickest growing group in the country, not only up until 2009, but from 2009 until present, they're the fastest growing group of individuals. The bad news is basically that Black cyclists are 4 times more likely to have a fatal crash than whites. And also Black pedestrians and motorists have two times the mortality compared to whites. And a lot of this is basically how the infrastructure is for those individuals. So a good example of this was R.J. Bear Grantham Jr. He was a 6-year-old, and he grew up on the west side of Rochester, and he was at the intersection of Thurston and Sawyer Street. There was no crossing or blinking lights at that intersection, and he was going with his sister to the store to get some candy. He was doing a little free ranging, and unfortunately, disastrously, he was struck and killed. And the community actually became outraged by this because there were more than 24 reports of crashes, and the community had asked for a crosswalk previously for that street. They eventually went to city council right after this and really expressed their outrage, and eventually a crosswalk with a blinking light was erected, and the community was satisfied, but it took a crisis. It took a child dying for that to happen. And then the same thing happened actually recently over in the Maplewood district, where they also had been campaigning for a crosswalk and a LED blinking light. And a 65-year-old gentleman was killed. There was no crosswalk at that time. The community was outraged again, and eventually the county DOT said, well, we can put one in. And several weeks later, they did put it in, but it took another person's life to be lost before they were able to put the money out for the infrastructure. And I'm going to go into a little bit of that in just a minute in terms of the transportation design failure that we have. These transportation structures that we've seen currently, they really were started in the 1950s, and then they enabled us to segregate and also promote white flight among commuters. The old school DOT car crash-centric strategy has been hard to actually reverse, but we're actually making progress, and I'll go into that quite a bit in just a bit. But the safety inequalities in underserved areas continue, and they need to be addressed. And now I think the traffic engineering community and our legislators are trying to address this. One of the sort of parallel concerns is, do bike lanes actually cause gentrification? And another way of saying saying this is, are bike lanes white lanes? There was a book a number of years ago written called Bike Lanes Are White Lanes, basically making the supposition that when you put bike lanes down, that the streets would be gentrified. Well, there was a large study that was done to actually address this question. And it's actually a beautifully done study. It looked at bike facility inequality over 10 years, looked at 29 cities, but it actually divided it into all different groups. They very selectively picked large cities, small cities, intermediate, medium-sized cities like Rochester, cities with good bike infrastructure, cities with poor bike infrastructure. They looked at a whole variety of things and really did a great job of looking at all the different potentials. And they basically found that, and they took 11,000 bike lane miles and looked at 11,000 block groups, which are basically groups of 300 to 600 people on a street. And what they found is that the BIPOC bike and pedestrian facilities were underfunded for decades. And we're sort of still catching up in those communities because their infrastructure it takes a lot of money and a lot of time to rebuild those infrastructures. In addition, they found, quote, socioeconomic and demographic changes were more correlated with bike facility installation than inverse. That's a little bit of a complicated way of saying that as a neighborhood progresses economically, then they sought more bike and pedestrian facilities. In other words, it kind of makes sense. If you're working three jobs and you're just struggling, then you're not very likely to want to go out and get and campaign for bike and pedestrian facilities. But as the neighborhood sort of gains economically, you get a little bit more money, a little bit more time, free time, you can actually campaign for safer pedestrian structure, safer bike structure. And so that actually is what they found. In addition, they noted that bike facilities were not linked to displacement. In other words, there was no evidence that putting a bike lane down actually causes a community to gentrify. It's really the economic development that occurs, and then people want bike lanes and better pedestrian structures. So let's talk a little bit about safety. In Holland, we're going to go back to Holland again. Biking and walking actually has a traffic calming effect, not only for bicyclists and pedestrians, but for cars. The bike commuter rate, again, is over 30% in Holland. And the motor vehicle fatality rate for motorists are actually 3 times lower in Holland than they are in the United States. The bike fatality is 3 times lower in Holland than the United States. And the pedestrian fatality rate is actually 6 times lower than in the United States. So it really shows you how infrastructure can have a huge impact in terms of making things more pedestrian and bike friendly and getting people out and exercising. So there's a good book called Door to Door that basically dug up a lot of data. And one of the interesting data pieces that I got out of that book was basically the U.S. serious motor vehicle related injury rate. This is the trauma rate in the United States for motor vehicle related injuries. 2.5 million serious motor vehicle related trauma ER injuries per year. Now, if you take that over a lifetime, 2.5 times 80, simple arithmetic, that's 200. That's 200 million Americans annually will have, 200 million Americans over an 80-year lifetime will have a motor vehicle, serious motor vehicle related trauma injury. And at the current rate of, injury in the United States, that's 2 in 3 Americans that might have a serious motor vehicle related injury at the current rate. That could be you, that could be me, that could be one of your family members, but we've all had individuals that we know that have had some kind of serious injury. So taking that into context, the door-to-door author basically noted that those wounded on US highways annually exceeds the number of all the wounded and dead in the United States and the Civil War. That includes World War II, World War I, Korean, Vietnam, Afghan, Iraqi in the War of 1812, and the Revolutionary War combined. That total actually happens every year on our streets. It's kind of a hard thing to wrap your mind around, but it's a massive amount of loss. In addition, CDC came out with another study. It was just published in 2022, looking at the 29 developed countries that were basically sort of on par with the United States. And they found that the US motor vehicle accident fatality rate was the worst of the 29 Western developed countries. The US fatality rate was 3 times higher than the 18 other high-income countries. So we really do have a problem. And let's get into, what that's all about. In addition, though, I want to say he also noted that there were the economic and societal impact costs of motor vehicle death and injury is about $836 billion annually. That's almost $1 trillion. And it includes lost productivity, the legal and medical issues. And that is basically not reflected in our Department of Transportation budget. Our traffic engineers don't see that. We see it. It's in our taxes, in our insurance premiums, in our medical fees, and that human suffering is we see on a personal basis as well. But it's sort of hidden. It's like it's like a ghost that isn't talked about. It's like an elephant in the middle of the room that nobody talks about. So in addition, air pollution accounts for about 48,000 deaths per year. And then there's all the cardiovascular and respiratory problems that occur in addition to actual deaths that we see as clinicians. So safety, where is the failure in terms of this, the health and safety failure? Well, is it basically an enforcement? Do we need to get more police on our streets to monitor and to minimize the crash rates? Well, we've been trying to do that for the last 50 years. And to be honest, our enforcement is predominant as any other country that's in the developed group that we just discussed. So I don't think that that's really going to make the difference, although having a good enforcement is helpful. The same thing is true in terms of education. It's not enforcement or education, although the traffic engineers would like to point to that, and I'll tell you about that in just a minute. They'll say, well, he was driving too fast. That's why it happened. But in reality, it's more of an engineering problem. Other countries have figured out how to engineer their roads so they're safe, so they facilitate people that want to bike and walk and to drive more safely. So in the past, traffic engineering priorities basically looked at capacity. Capacity is king. If there was any type of congestion, then they would just build another road, another lane, and another wide lane, and that encourages cars to drive faster and farther. And so we just kept sprawling and sprawling and sprawling until it was really, it's really not sustainable. And it actually causes implosion in terms of our cities, in terms of their being robust. The other thing that they prioritize is basically speed. They want people to go from point A to point B really, really fast. And they've done a good job of it. If you ever go up 590 during rush hour, it's a 55-mile-an-hour zone, but people are routinely going 70 miles an hour without thinking about it, and there's no enforcement. In addition, they're very concerned about costs whenever you raise the question of, well, we need a crosswalk with a flasher. They say, well, we can't quite afford that until a tragedy happens. In safety, they talk about safety. Safety is our priority, but in reality, when they make those decisions, it's really capacity, speed, and cost that take far more precedent over safety. Our traffic engineers are not well educated on safety, and our system doesn't really prioritize it. So Jennifer Hamady, who's the chairman of the National Transportation Safety Board, she was at the National Bike Summit and she put it best, and she's a biker also. She basically said, we must let go of the idea that education and enforcement will stop the problem. The entire system is failing to protect people, all people on the roads. She said, we must ask the tough questions. Why do we allow motorists to speed? And we should also ask, why do we allow traffic engineers to design roads that encourage motorists to speed? And she also asked, is the infrastructure designed to prevent crashes and protect riders? And if not, why not? So we need to start asking our legislators and our engineers, our road engineers, to start building safer roads. And the traffic engineering community is changing. There are a number of books out. The one that is most dramatic is Killed by a Traffic Engineer, and I've just finished several hundred pages on it. And it really indicts our current engineering system, the way we design our roads. So there is a solution to this. It's called Vision Zero, and it was first developed in Sweden. And remember, Sweden was one of the low carbon footprint countries in 1997. They started this idea, and the objective is to reduce the rate of motor vehicle crash deaths to zero and injuries to zero. Now over 30 countries have embraced this in over 50 US cities. And I'm proud to say that Mayor Malik Evans a couple of weeks ago announced that Rochester is a Vision Zero city and is forming a task force to do that. So let's look at the Vision Zero approach and compare it to the traditional approach. So the Vision Zero approach, the traditional approach is that traffic deaths are inevitable, that those 42,000 deaths and the 2.5 million serious motor vehicle related injuries, it's just the cost of doing business. The Vision Zero approach, however, is that traffic deaths are preventable. The traditional approach is that there's perfect human behavior. They think of us kind of like we're red blood cells in a vascular system, and we always will be very predictable in terms of what we do. But the reality is that we need to integrate human error into an approach. We're all fallible. We all make mistakes. And the important thing is that when you design an infrastructure, that it takes into account human error. The traditional approach thinks that we need to prevent collisions, and they look at all collisions as sort of in one group. The bad collisions where people are either seriously injured or die, along with the fender benders. Whereas the Vision Zero group tries to prevent fatal and severe crashes. And a good example of that is the Vision Zero approach is actually, think about a roundabout. The crashes there are usually fender benders, and it's rare to have a fatal injury. Whereas in a T-intersection or a regular cross intersection, sort of our traditional way of designing an intersection, when there is a crash, it's more likely to have a fatal or serious injury outcome. So the traditional approach says, well, it's the motorist problem. They need to slow down. They need to be more conscientious. Whereas the Vision Zero approach is basically a system approach where they design the system so that people are basically are not enabled to go fast. They're actually encouraged to go the speed limit, to do things that are safer. The traditional approach, basically saving lives is expensive. And the Vision Zero approach is that saving lives is not expensive. It's actually expensive not to have a Vision Zero approach. Remember what I said about the economic and societal costs of motor vehicle death and injury? $83 billion annually. Well, we're paying for that. The Department of Transportation doesn't look at that. That's not in their budget, but it's in our budget, in our taxes and in our insurances. So the safe systems approach basically is one of the solutions. We want to get safe road users, safe roads, and safety is prioritized over speed and congestion avoidance. In addition, safe vehicles, safe speeds, and post-crash care. For healthcare practitioners, post-crash care means that when somebody is injured, we get them to a trauma facility or a facility where they can be taken care of in a timely fashion. So one of the fundamental problems that I've learned over the years is how we sort of separated health and safety. They've really become silos. And what we really need to do is sort of get the Department of Health and the CDC, the US Department of Health and CDC, and the US Department of Transportation to be working together. And we're now starting to see that with the current administration. In addition, getting the State Department of Health and the State Department of Transportation to work together on a county level as well. So as bike and pedestrian rates increase, streets become safer. Portland, Oregon bike crashes went down by 50% as bike traffic increased 9% annually. So there's a safety in numbers as you see more bicyclists and pedestrians around on the roads. There are also economic benefits. In Portland, they invested about $2 million a year over 15 years for bike infrastructure. It was about $32 million and over 15 years. And the benefit to cost ratio was 3.8 to 1 on that alone. And then the community actually saved $1.1 billion annually in retained community dollars. That was about 1.5% of all the individual revenues of the region. The average US family spends about 19% on transportation. In Portland, they spend about 15%. That's a 4% annual savings, like having 4% less taxes. So that Portlanders were twice as satisfied as the national average with their transportation. We call that the green dividend. So demand for cycling and pedestrian infrastructure improvements also is very strong. I think I'm going to skip through this a little bit. But Americans would spend about 22% of transportation dollars on biking and walking infrastructure. That's about 15 times what currently is spent. So this is just an example of a protected bike lane where you have cars that are separated from bicyclists and pedestrians by those ballards. This is what we want to see in the future. So what can we do? Well, we can promote benefits, the benefits of biking, educate the public and patients about the mental and health well-being benefits of cycling and walking. We can also advocate for better infrastructure, including bike lanes and safe crossings. This is Pennsylvania Avenue. We were on our way up to the Capitol to meet with Joe Morelli and our congressman and other constituents to campaign for better bike and pedestrian infrastructure. We can also join and support local bike and pedestrian transit organizations, contact our state and local legislatures when there's a call to action. And one of the things that you can do is go look at the Reconnect Rochester website and register for the call to action list. 3 or 4 times a year, they'll ask you to actually ask for, let's say, a 3+ foot safe passing law for the state. Monroe County, we're blessed by Adam Bello and the county exec and the county legislature. We now have a 3+ foot safe passing lane. We also want to get a Idaho stop law, and we can go into that if you're interested. This is a slide I'm really proud of. We have a mayor that gets it. He is really supporting bike and pedestrian infrastructure. So is Adam Bello, our county exec, and Joe Morelli, our congressman, is also a strong backer, along with Black Girls Do Bikes, who's up on the second from the left, and a number of other organizations. What can you do? 40% of all trips are less than 2 miles. Incorporate movement into everyday routine. Bike and walk to coffee shops, stores, and work. These are some of the groups that are available. This is the Santa Ride, which is a lot of fun. It's the only time that we're riding on the streets and cars are honking at us, but they're honking because they want to take selfies with you. We're waving back. This is the Light Up the Night ride. So there's a lot of rides that are available. So in summary, built environment directs how we move and work and play, and it determines our carbon footprint. So it directly impacts climate change as well. So I encourage you to bike and walk to the future. Thank you.
Thank you so much for that. It was a great presentation, and a round of applause, digital applause from the audience here. And why don't we stop sharing and let's open it up for questions. So Dr. Susan Friedman, our Director of Clinical Studies, and Dr. Carrie Graff, our Medical Director, will turn on their cameras. Actually, one of the things that I do, you mentioned that I'm a hiker. I am a hiker. I have my 46er. I've climbed all 46 high peaks in the Adirondacks. So I also am a green birder. I don't know if you've heard of that. So
No.
I like to do a lot of I do a lot of my birding by bicycling or walking, try to not to burn any fuel. I'm not entertaining myself and entertaining the birds at the same time. So anyway, what kind of questions we have there, Doctors Graff and Friedman? Any
No
questions?
actual questions, but definitely the Holland school buses get a major thumbs up, right? So super,
Mhm.
super cool.
That was kind of fun when I saw that. I had a good laugh.
Yeah. And don't they do
Do you-
something like that in the blue zones? They have the kids walking together, right? In like a little school, they make a school bus, right?
The walking school bus.
The
Yeah,
walking
that's the
school bus.
walking bus. There's also bike buses where there's a parent in the front and the back, and that especially is common during bike to school week, bike to school days.
Yeah.
And there is a Safe Routes to School program nationally. So and we do have, every year, during bike week, we have a bike to school day. So if you're interested, you can contact Reconnect Rochester and they could connect you with that.
Could
Absolutely.
you talk a little bit more about Reconnect Rochester? And because I've noticed that bit by bit there do seem to be more bike lanes. Is there kind of an overall plan? How is that? How has that evolved, and
Yeah.
who's involved, and yeah, how does that work?
So, well, I was actually a past president of Rochester Cycling Alliance, so we decided to merge with Reconnect Rochester, which was more of a transit walking group in terms of advocating for that. And so we merged a number of years ago, and they've been very active in terms of that. They're really pretty much the central group in Rochester in the region. There's also a whole bunch of smaller groups, Color Irondequoit Green, in Irondequoit and Penfield and all these other communities that now are sort of forming bike and pedestrian advocacy groups as a part of that movement. But Reconnect Rochester has worked with the city, and now the city just finished their bicycle master plan. And there's what we really want to do is sort of connect the spines. We have all these bike lanes to nowhere because and we had the picture that I showed you was actually sort of a culmination of that of a rally that we had where we all rode to the city, and we were fortunate enough to get the mayor. Then the county exec jumped in, and then we had Joe Morelli, our congressman, participate. And the concept was that we want to build a north-south and east-west network that's continuous, that's protected. The biggest issue basically to really get people out on bikes, the average person, is to get protected bike lanes and protected facilities. And so that's what we're doing now. So one of the things that is sort of interesting, or it's been a battle that Reconnect and in a number of other groups have really gotten on board, was just putting a bike lane on a non-city of Rochester street. I didn't understand this until more recently. The county does not put bike lanes on not city of Rochester streets. So if, let's say, you're going from Little Wegmans down Winton towards I ride to Meridian Center, there's a bike lane that stops at Highland, and then it becomes a quote paved shoulder, and that has been the tradition in the county from the very beginning. Well, we actually fought when Elmwood was resurfacing. They actually from Goodman to 12 Corners, they actually considered doing what we call a 4-3 conversion, where they take a 4-lane road where cars are racing side by side and convert it to a 3-lane with a center turn lane. It's a lot safer. And then they wanted to put bike lanes on the side. Well, the county said, no, we don't want to do that. The county DOT. Adam Bello and the Brighton Town Group, and they all campaigned, and we've got our first bike lane on Elmwood, which is a non-City of Rochester bike lane. It's kind of ridiculous that we don't have them, but Adam Bello just announced that they're going to do 4 more. So now we're starting to see this, and that really encourages people, even though it should be a protected bike lane. Someday, hopefully we will get it, but that's a good start. So it really takes people campaigning, and physicians and healthcare practitioners are actually really influential when it comes to going to legislators. And one of the things I want to try to do is educate people, about the health benefits and how health and safety are really sort of intertwined.
Scott, we have kind of a national audience. I'm just wondering if people are in other cities, other metropolitan areas, is there a national organization they can contact to get advice on where to start?
Oh yeah, there's a great League of American Bicyclists that
Okay.
does the annual meeting. They have terrific facilities. They can link you to a local, usually a local bike advocacy group. And they're springing up all over the place now because people realize that there's a lot of benefits to the community to have a good pedestrian and bike friendly community.
Great. So we have a good question in the Q&A, but before we get to that, I just want to quickly just take over for a second, just to tell people about upcoming events that are available. So we run these programs pretty much continuously. The 15-day whole food plant-based jumpstart program, which we run every month, the Lift Project, which we run on a regular basis, and also health coaching, both individual and group. And if you visit rochesterlifestylemedicine.org, you can learn how to register for those. And then, of course, we thank you all for attending. We are a nonprofit. We do pay our staff, although my wife and I are full-time volunteers. But we'd love it if you could consider making a donation. You can aim your phone at that QR code, and Bob will also put a link in the chat so that you can click on that and take you to our donation page. And with that shameless plug, I will stop sharing now. And I think Dr. Graff saw the question in the Q&A. You looked like you were about to.
There's a question from Colette. Do you have any suggestions for safest bikes for senior women? I'm 78 and love to bike outdoors.
Yeah, I mean, if you're concerned about falling, a recumbent bike is actually a great option for people. And a step-through bike, makes it a lot easier to get on your bike. If you go to Holland, almost all the commuter bikes are basically step-throughs because it's easy to get on and off. You don't have to be sort of swinging your leg over the bike. So there are also bikes that have 3-wheel and 4-wheel bikes. Bob and I were talking before the session about that. There's a lot of popularity. One of the issues is basically during the winter, what do you do about that? And now, more and more people are buying fat tire bikes that are motorized or e-bike fat tires. And those, can get around, especially the winters are milder and milder. And so that facilitates. They often say there is no bad weather. There's just bad gear. I've learned to put, all different, I know exactly how much to put on. I look at that weather report. I walk outside right before I go out and ride, before I commute. And I pretty much have it dialed in. If you have the right clothes, it can be very protective.
I wanted to share something that has not so much to do with this, but my grandmother rode her bike way into her 80s, and bike riding with her down on the Maryland shore are some of my favorite memories of her. So even into her 80s, I would have trouble keeping up with her. So.
Yeah, it's a great way. I think that in terms of longevity, keeping your leg strength is really, really critical. Keeping balance and leg strength, and biking sort of encourages that. So does walking, so does hiking, doing what Ted does, where he's hiking up and down hills and mountains and things like that. You're gaining really good equilibrium
Well,
training.
and it's also fun, right? So there
And
you
it's
go.
fun. Yeah, yeah. That's what I keep on forgetting when I do bike advocacy. It's all this stuff is fun. And
Mhm.
you really do. I mean, there's a group called Just for Giggles, and that kind of captures the you know, the joy of biking very well. And you know, it's a fun group of people.
Yeah, I
I
was
love,
noticing.
sorry.
That's it.
No, I love the point about the multisensory experience. You know, it sort of pulls in the idea of mindfulness and um, you know, really sort of paying attention to where you are and rather than just, you know, eyes on getting somewhere else. So yeah, it's a
It's
nice
kind of
point.
mind numbing, you know, when you commute, especially if you're, you know, going down a highway like 590, you know, I'm going down 590 if I do car commute. And it's kind of frustrating. It's kind of, you're nervous all the time because somebody may cut in front of you or try to cut you off. Um, Whereas if you can find a good pathway to get to work or to wherever you want to go, um, then you know, it's really relaxing. It's invigorating. One thing that Reconnect Rochester does, they actually offer sort of a mentor program where if you want to get from point A to point B, Jesse Pierce, who's the bike coordinator, he actually in his group will actually kind of coach you and maybe come out and show you, you know, where the bike boulevards are. Bike boulevards are low traffic roads that now the city is starting to build. Portland has a tremendous network of bike boulevards. And in Portland, 20 is plenty. Rochester is actually reducing its speed limit to 2025 as a result of a lot of campaigning that we've done with the state.
That's great. All right. Well, thank you so much, Dr. MacRae. It's now 9:05, and we appreciate the time you've spent with us. It's been a fantastic evening. And Drs. Friedman and Graff, thank you so much. And Bob Frankie, our engineer in the background, thank you. And thank you to all of our attendees tonight. And look forward to seeing you at our upcoming events. So good night, everybody, and have a pleasant evening.
Good night.
Bye.
Thank you.
See you next time. Okay.
Great talk.
Thank you.